Welcome to the Ignition News. We love to have you here, but remember to follow us on your favorite podcast platform. Click that like button, that subscribe button, and leave a comment below. It's going to be a great show. Welcome to the Ignition News. Let's get busy with the truth. Good morning and welcome to the Ignition News. It is April 24th, 2026, and in case you can't tell from my voice, I'm not feeling very well. In fact, I'm not sure what's going on, but inclusive of both times that I had COVID and any time that I've had the flu, I've been absolutely knocked out. So I just wanted to check in and let you know that aside from this recording, I hope to be back on Monday. But I did want to take this quick opportunity to let you know really how tragic the American healthcare system is. Inclusive of this experience, my entire family, and as you know, I recently had to deal with a rabies scare. I've had a front row seat to two of the most devastating things that are happening to the American population. Number one, the lack of social safety nets of any kind. And number two, our crumbling healthcare infrastructure. People often criticize me for saying this, but I think that the advances made by the Affordable Care Act actually made healthcare worse in this country. Not because the intention was bad, but because we continued to fight against the idea of universal healthcare in this country. I can say that only from the lens of someone who most of my life has had private healthcare funded through my employer. But this is actually the core flaw, not the Affordable Care Act. I say this because I grew up in poverty, and when I got my first job, making about $12 an hour, which incidentally now is the equivalent of about $23 per hour, depending on which calculator you use, I had amazing employer-provided healthcare. This was at a time when that benefit in particular was a really important part of an employer that you would select. And I remember on several occasions having to use either a walk-in clinic or an ER and receiving excellent care, and sometimes paying as little as $10 for a copay. And then on most occasions, seeing a very small bill on the back end or no bill at all. So from that extremely myopic and really unfair lens, when I compared that experience to my current experience, still utilizing a version of employer-provided healthcare for our family, I can say that it has become exponentially worse. With the rising deductibles, the quality of care in this country, and of course, the total cost. But that is not anything to really talk about the experience that most people have with their healthcare. And that is inclusive of the men and women who seek to provide that care to us every single day. All of them, I assume, doing the very best they can to be excellent in their field, yet constantly challenged by politics, by social media, by health insurance, and increasingly by hospital administration. I think we like to think of America as a rugged individualist country, but the reality is part of our brain likes to think that that rugged individualism is the ultimate safety net, when nothing could be further from the truth. When you really look at it and you really break down America and what happens when the least of us are put in the worst of situations, it is quite simply deplorable. And we need to start really confronting and grasping the fact that in addition to arguably one of the worst healthcare systems on the industrial world, at least of the 180 countries that I researched, that the reality is people simply avoid getting healthcare that they may need, even if they have affordable health coverage. As we will discuss, 36% of Americans avoid getting healthcare because of cost, even if they have insurance. Avoid getting medical care because the cost of doing so is too expensive, even with their health insurance. Now, of course, the obvious part of my earlier conversation is that I was viewing this from the myopic lens of having employer-provided health coverage, which a gigantic portion of the American population simply does not have. That quote-unquote safety net of healthcare was directly tied to employment, and I, like many people in this country, faced the constant challenge of knowing if you leave your employer, you will no longer have any kind of affordable healthcare. I don't know if you've ever seen a COBRA plan after you leave work, but It's simply, you have to remember, you're leaving work, you're getting on Cobra, you don't have income, and the Cobra plans can be outrageously expensive. The point here is that I acknowledge my view of the American healthcare system was from that myopic viewpoint. But now, from a new perspective, I can see truly how much worse it actually is. And that is, of course, not to talk about the other complete failure of America's social safety nets, things like retirement, which we have pension plans that are constantly gutted, or unemployment. Why don't you do a project and look up how much the weekly unemployment benefit is in your state and try to imagine how you would survive in a scenario where you lost your job? But let us go back to healthcare briefly. If you live in the United States and get sick, your own country is betting that you can't afford it. That's actually the business model. Today on the Ignition News, I'm going to run the numbers side by side. The United States versus every other wealthy democracy on earth. Because the story has been really well kept from you by the media and by our own government. The idea somehow that universal healthcare would cost too much, destroy quality, and crush taxpayers is simply a myth. But when you really start to understand how bad it is, it's outrageous. In 2024, the United States spent $14,885 per person on healthcare. Per person. Every adult, every child, and infant. That is the average. The next closest wealthy country was Switzerland at $9,963. The average for every other wealthy OECD nation, the ones with universal coverage, came in at $7,371 per person. Less than half of what we pay. Part of the reason is we spend 17.6% of our entire economy on healthcare. The OECD average is 9.1%. We are spending almost double the share of the GDP that Germany, France, Japan, the United Kingdom, Canada, Norway, and Sweden spend, and we are not getting anywhere close to what they are getting. So let's talk about what that actually buys. American life expectancy in 2024 hit 79 years. That is the highest it's ever been. Sounds fine on its own until you compare that to other countries. The average lifespan in peer countries, the ones where we outspend, is 82.7 years. Americans are dying nearly 4 years earlier than people in UK, Germany, Japan, France, and Australia. Perhaps most disgustingly, infant mortality. The United States in 2023 lost 5.6 babies per 1,000 live births before they reached their first birthday. The OECD average is 4.2. Estonia leads the world at 1.7. Think about that. A baby born in Estonia is more than 3 times as likely to make it through year one as a baby born in Detroit. Then there's maternal mortality. American women die during or shortly after childbirth at a rate of 18.6 per 100,000 live births. That is several times higher than every single European country we consider a peer. Here's what the insurance industry propaganda machine really gets to work. They tell you universal healthcare means crushing taxes. So let's go look at what people actually pay. Let's go to the UK. The UK funds the National Health Service through general taxation and national insurance. Total cost per person, about £2,700 a year. That's roughly $3,400. That's the whole bill. Comprehensive coverage. No copays for most visits, no deductibles, no networks, no prior authorization, no surprise bills, no bankruptcy if you get cancer. That's the entire bill. The average American household spends $12,000 per year on medical expenses when you add up premiums, deductibles, copays, and out-of-pocket costs. And that is if they have insurance. If they do not, then emergency rooms can end them financially. Most people I know have annual deductibles close to that $3,400 anyway. Germany funds its system through mandatory contributions split between employer and employee. Total spending runs about $6,500 per person. Comprehensive coverage for every legal resident. France about $4,200, Canada about $6,000, Japan is just over $5,000. Every single one of these countries covers everyone. Every single one of them spends less than half of what we spend, and every single one of them delivers better outcomes. One of the dirtiest open secrets about the American healthcare is administrative overhead. The United States spends over $1,000 per person just on healthcare administration, 5 times more than the average peer country. We spend about as much shuffling paperwork, denying claims, and processing insurance billing as Sweden spends on actual long-term care for its elderly. Sweden spends 22 times as much on long-term care as it does on admin. We spend roughly the same on both. 36% of American adults, insured adults, delayed needed medical care in the past year because of cost. More than 1 in 3. See, actually, I have to correct my earlier statistic there. In the European Union, that number is 3.6%, a tenth. 100 million Americans currently carry medical debt. 100 million. That's about a third of our country. Between 62 and 66% of all personal bankruptcies in the United States are driven by medical expenses or income lost from illness. In Canada, that number is about 19%. In Australia, 10%. The United Kingdom, 8.2%. The countries with universal healthcare do not have a medical bankruptcy industry. We built one. So here's where it ties together. The American healthcare system is not as much broken as it is functioning exactly the way that it was designed to function. It extracts maximum wealth from working people in exchange for ratioed, delayed, and denied care. It's the single biggest wealth transfer from the working class to the shareholder class that happens inside the American economy every single year. Every country compared tonight, the UK, Germany, France, Canada, Japan, Norway, Sweden, all of them arrived at a different answer. Not because they love socialism, but because they did the math. It is cheaper to cover everyone than it is to cover nobody. It is cheaper to pay taxes for the NHS program than to pay premiums to United Healthcare. And when you cover everyone, preventable deaths drop. Maternal mortality drops. Babies die less often. Life expectancy rises, and medical bankruptcy just never happens. The only people who benefit from this are the shareholders of insurance companies. And by the way, these are people who fund both parties. They are the people who help to write the legislation. They are the reason that Medicare could not negotiate drug prices for most of its history. They are the reason, again, that the public option was stripped out of the Affordable Care Act. They're also the reason that Medicare for All cannot get a vote on the floor. In Norway, the maximum you will pay for healthcare every single year is $350, whether you go to the doctor once or you spend an entire year being treated successfully for cancer. You will only pay a maximum of $350. It is hard to imagine that happening in the United States, but it will never happen if we don't try. I will be off the Ignition News until at least Monday. I hope you understand, and we'll see you back. Stay tuned.